powerful conversations. JV EdTech Medivation, in collaboration with Power of Knowing Forum, proudly announces a healthcare podcast series focused on the future of healthcare innovation. This next-generation podcast series explores hospital systems, medical technology, AI in healthcare, and innovation, bringing together experience, expertise, and meaningful dialogue. The series delivers real-world, actionable insights from global healthcare leaders, moving beyond theory toward practical implementation and impact. Beyond theory, this podcast series focuses on real impact by bringing actionable insights from global healthcare leaders, doctors, and technology innovators. The conversations cover key areas such as AI in healthcare, telemedicine, smart hospitals, and emerging medical technologies that are shaping the future of healthcare systems worldwide. Medical schools, healthcare institutions, students, faculty, doctors, and healthcare professionals from India and across the world are invited to be part of this journey. Backed by Power of Knowing Forum's 300-plus episode legacy and aligned with global standards, the series offers structured, easy-to-understand learning for both executives and learners. Our shared vision: make healthcare knowledge accessible, innovative, and impactful. Encourage global collaboration in healthcare education and technology. Empower the next generation to listen.
A very good evening and a warm welcome to everyone. Thank you so much. It's an indeed pleasure with JVA Tech Motivation. I, Dr. Jyoti Rao, host of the event in collaboration with Power of Knowing Forum, starting a very first collaborative healthcare podcast series, which is MedTech Insight. Thank you so much. Indeed, it's our pleasure to talk something very important. 2 minutes to act. Why cervical cancer is still killing women in age of prevention. Let me take this opportunity to introduce one and only Dr. Mohammed Kausar Niaz. Thank you
Yes.
so much, Mohammed Kausar Niaz, for being with us. It's an indeed pleasure. Allow me a great highlight I can share at this moment. Thank you so much once again, everyone. So, Dr. Mohammed Kausar Niaz completed his post graduation in biotechnology from Interdisciplinary Biotechnology Unit, Aligarh Muslim University. He is a founder and managing director at Abir Biosolution Services, which is non not for profit, non governmental organization, NGO, and it is integrated under the Section 8 of the Companies Act 2013. He received PhD in molecular biology from the Department of Bioscience, Jamia Millia Islamia, New Delhi. He completed his doctoral research in collaborations with National Institute of Cancer Prevention and Research, Noida. His doctoral research specialized in molecular characterization of tumor suppressor gene in human papilloma virus infected cervical cancer in Indian population. Dr. Niaz took up a postdoctoral research fellowship at Indiana School of Medicine, Indianapolis, USA. It's an amazing to see many accolades. Thank you so much and a warm welcome. Dr. Niaz would like you to share a couple of amazing and insight from you on your current journey. Thank you. Over to you.
Yeah, good evening, Dr. Jyoti. First of all, I would like to thank you, for giving me this wonderful platform this evening to share my experience, as well as why and when we started this foundation. So it was long back, you can say 2011 when we started, and we have a very clear cut objective, or you can say mandate for this foundation. We are very much close to preventive health advocacy, awareness and all across the country, mainly low and middle income countries including India. So uh, if you look at the disease burden mainly related to women and girls according to WHO, because of deeply rooted culture, socio-cultural factors are there. So one of the cancer that we are going to talk about today is cervical cancer. It is related to women and girls. So it is preventable, but still we are losing one beautiful women. If we're talking about the Indian data, according to ICMR, Indian Council of Medical Research, on average 7 to 8 minutes we are losing one women actually, and at the same time it is 100% preventable. So I thought this foundation has a noble cause actually, and we all are together now. So it's not a single man show actually. So when we started, I was alone with a couple of friends, and now it's going into the organization, and day by day we are doing this public engagement activity. Thank you.
Amazing, amazing. As the theme which we have chosen, 2 minutes to act, and it's really important subject too. So this, when you talk about how and reality perspective, like what human reality does one woman dies every 2 minutes represent? What is your take on this?
uh, to be honest, it's just not about the numbers actually, because we all know the statistics. This is a global data. You are talking about 2 minutes on average, one woman we are losing, anywhere across the globe. For me, something it is personal actually. Say for example, when I was started my research from one of the ICMR institute, that is National Institute of Cancer Prevention Research in Noida. When we are working on this particular cancer, we try to understand, why the tumors are more common in certain age group actually. Let's say 35 to 45, and we did some molecular characterization in the lab at that time, and we tried to understand how this particular HPV infection that is very common, and it's one of the causative agents for this particular cancer. So whenever we receive a sample from clinics, from the hospitals to our lab where we're doing the research, there always a question. We are not taking that as a case or as a numbers actually. Okay, we got two samples or three samples, or three cases or five cases today in that OT actually. It was quite alarming when we review the literature long back, around 2003 or 4 when I started my, PhD thesis. So there's something in between actually. Let's say if some women is lying down in the OT, there might be someone's daughter, someone's wife, someone's mother actually, and they are battling for their life. So as per WHO guideline, we have a clear mandate, a strategy actually to eliminate this cancer by 2030, and it was not there at that time when we started the research. So something was there in my mind how to prevent this preventable cancer. So uh, through this forum also we are going to discuss in detail as well what are the strategy, what is the mandate by WHO, so that we just follow those guidelines, and then we can prevent this preventable disease, and uh, we can say okay, no queen can lose the life because of this cervical cancer.
Absolutely, very well said. The statistics which represent systemic silence and delayed care. It is a woman who never received a screening, as you mentioned, mother whose symptoms were normalized or ignored. The family might have entered into the healthcare system, but it really reflect at times the missing opportunities. So prevention, education, early detection, and timely management does matter. Let us deep dive today the numbers to system. The second question would be, where do you see the system fails most, before screening, during diagnosis, or after detection? Your insight.
See, according to me, as per my experience in last 2 decades, you can say, because what I see is these all factors are very, very important. That whatever I mentioned today, but once the detect, once we detect the disease, and then we have to decide, and you have to take the clinical intervention like treatment options. Here there is a huge gap, you can see. It's not about the screening only. We have good foolproof system. We have good labs across the country right now. I'm talking about uh, mainly post pandemic, because we have real time PCR labs where we can use easily, as per WHO mandate, where we have to screen 70% by high performance test, and go for vaccination at least for 90% by age 15, that we're going to discuss today also. What I'm trying to say is, even if we have a high performance test, labs are there, but after screening, when we need a treatment, there is a huge gap across the country, mainly in low and middle income countries. So I think here is we need to work a lot together. Actually, how all the partners come together and jointly work to bridge the gap. It is important to treat as per again 90% of the WHO guideline. If we find any lesions or any kind of pre-cancerous stage where reversal is very high, you can go back to the normal if right kind of treatment has been taken care of after the detection at the right time. So according to me, I think detection stage is very very important, and we have to really work on how to control the disease, not to progress and regress, so that we can save the life, even if disease little bit progress towards advanced cancer, you can say. But before that, we have enough time to reverse back to the normal. Actually, this is what I wanted to tell you on this forum as well.
Absolutely. Absolutely. Very well said, doctor. Anything which start with the screening where awareness access and when even there is possibility of the trust breakdown. However, any system or the screening happen when it a developed country, underdeveloped countries, and still developing countries. The situation does matter. India, starting with the developing countries where we are facing a different issues at the different segment, as you correctly mentioned. And obviously, when it comes to the from numbers to system, there is a much more to talk about it. Now, let me ask you, why does cervical cancer persist in LMICs despite of available technology and the knowledge? When I say the lower middle income class, is there anything you can talk?
I think this is one of my favorite area where I always talk about on different forum. Uh, One significant term that we usually use, that is inequalities. Inequalities, what I mean actually is in access to prevention, sometimes in access to screening also, as we discussed, and sometimes definitely there's a treatment service that is required, whom we screen actually, and they are positive actually. So uh, because of the poor overall, I'm talking about overall poor healthcare infrastructure weaknesses actually, or sometimes there are some financial constraints also, that is deeply rooted in due to different socio-cultural barriers also sometimes. So these are the factors. Even if we have everything in place actually, but it is not accessible across the country, you can say, mainly in low and middle income countries. And if you talk about this particular disease where a lot of factors are responsible actually, for example, particular cancer is not a single event actually. It leads to poor environment where you live actually, sometimes the diet, sometimes your gene actually, so sometimes your definitely the lifestyle. So these important parts, if you look at the underprivileged community actually, so they don't have good lifestyle. Even if they want, they don't have proper you can say hygiene. So lot of factors are there that is equally responsible towards this cancer burden, even if we have uh, you know uh, enough services actually in urban population that is not there in the rural population. So especially in low and middle income countries, country like us, like if you go to east, west, north, south, center, a lot of villages are there where primary healthcare systems are not boosted up to address these kind of issues. There are no awareness at all in healthcare provider itself. So education, I think, is going to play a very, very important role. But I would like to add before education something, one word actually, the health education, because we all are educated. So I'm not saying we are not educated, but health education is something that is very, very important related to women and girls, because there are a lot of disease that is biased towards women and girls, mainly in low and middle income countries actually, as compared to developed countries. That's what I wanted to say on this forum as well.
Yes. Yes, very well mentioned that health education should not be limited to only a gender based, okay? It is a equal right, knowing
Yeah.
the equal opportunities, and having said that, whenever the limited health infrastructures are there in any countries, okay, and there is a
Yeah.
cultural
Yeah.
stigma around the woman's reproductive health specific with and the fragmented governance. This particular segment are underfunded, and it can really impact on the preventive programs. So, very beginning, when you say the cervical cancer awareness, the campaigns or the programs, it has to be taken to the
Yeah.
amazing healthcare policy level, which can really help and build upon the human reproductive health to prevent any further issues, and it can implement the scale as well as the equity. Now, let's dive down the diagnostics, medtech, and the continuation of a care. Dr. Niaz, what are the biggest gaps between screening, confirmation, and treatment? What is your insight?
See, I mean, there are two aspects to this actually. One is from patient point of view, and one is from healthcare point of view. So, uh, I mean, we need to make more and more awareness related drive. You need to do more and more awareness related initiative. This is one of the initiative that we are doing today from both the aspects actually, so that we can balance both the wings actually, and then they can come up on the common platform, and they can uh, you can say avail the services that is there around us actually. But we just need to you know make them informed so that they can take an informed decision. So this is what I wanted to add on to this
Okay.
actually.
That makes
Yeah.
sense, the informed decision. And I strongly believe that Abir Bio solution, when we happen to connect, and it is a great cause where we talk about the vision, and then when it comes to awareness. And somehow, when I also started the journey as a healthcare professional, it's been more than 16 years. The awareness plays a major role, and specific with the healthcare awareness can be taken only when we like-minded people come together. So as you correctly mentioned, doctor, when it comes to delayed confirmatory testing, poor referral tracking, and the financial barrier, these are the major gaps which can
Yeah.
really help, so which can really become the I must say the disastrous moment when it comes to the diagnostics. And the long turnaround the
Yes.
time, for example, a woman who has been screened but lost in the system before even she gets the actual treatment, right? So the beginning of the any
Yeah.
treatment without any integration, without any screening, or that actually become the false promise. So as you are correctly bang on stating that awareness plays a major role, even with the WHO guideline, what we say, it has to really abide by the criteria too. Now, next question to you,
True.
doctor. How can a point of care and indigenous medtech transform screening at scale when it comes to even digitalization? Yes.
I mean, so if you talk about the point of care system, the good part about this point of care solution is we can bring technology where it is required actually. Even if there is poor infrastructure, there is no trained manpower, then technology go at that community level actually, at the remote level you can say, and this is where this kind of disease where we need to bring solutions to everywhere, irrespective of the geographical location of that community actually. So point of care, I think definitely we already invested a lot. I'm talking about some government initiatives. They are promoting like anything. A lot of startups, to my knowledge, they come up with a lot of self sampling kit and some AI driven, colposcopy, pocket friendly actually. That's not like a big and bulky, you can say, the colposcope where you patient need to go there, then only they will screen. So now with the help of AI based, technology driven, supported by AI, but still human intervention is very much required. Trained manpower is very much required to understand the image that is digitally captured by that, AI tool. So apart from starting from the sample collection to the screening, and then sometimes a lot of tools that has been available to treat the patient right away at on his like his home actually. That entire technology can be go there, and at least they can manage at the primary level, and then if required they can move to any tertiary care setups actually. So I think maybe in another couple of years, not decade, I can say, we will have a lot of point of care technology where we can bring down this incidence and mortality rate where proper intervention is required actually. Yeah, thank you.
Very well said. When you talk about the power of technology and the point of care where the diagnostic does matter, so the speed, affordability, the decentralization, and indigenous medtech, which can be a critical point, as you mentioned correctly. In India, there are areas where we have a primary healthcare centers. We have secondary and the tertiary healthcare centers, right? So if you look at the rural setup also, where we have ashas or the anganwadis, or as you also mentioned that creating the awareness through the number of initiatives or the number of universities where people can get an idea at least, or at least they know that this is something which is a need of an hour and we have to literally work on. I must say at this moment, doctor, that we may not have an appropriate solutions when it comes to at the large scale, right? That is a real part, what we play. However, how we can really support work on the referral system innovation, and that can be as a part of our own journey in terms of preventive cervical cancer also.
I
Now,
mean, I think I would like to add one more thing over here. Uh,
yes,
you know,
please.
See, we have a point of care technology today, but if you look at the population size, if you look at the demand, even if we have a technology with us with the help of a startups or any medtech company, uh, but we need to scale up it actually so that whatever demand that we have across the country, at least they can supply those point of care technology to the end user actually. So government is going to play very very important role to scale up those ideas, or if there is a product, or if there is product is there but is limited, like let's say manufacturing is not scaled up as per requirement actually. We have seen during COVID time, we are the largest producer of the vaccine. We exported a lot of vaccines actually so far, and we are leader in that. But during COVID, we need to scale up those as per demand at that time. So this particular cancer also, there is a lot of burden across the country. We all know we have statistics with us, we have numbers with us actually, data is available with us. But uh, wherever there is a demand, there is a limited supply as far as these technology that we discussed in short today actually. I'm talking about the mainly point of care actually. So I urge everyone, all the stakeholders to pull up their socks and try to scale up so that we can meet the demand, and catch this particular disease and prevent at early stage. Thank you. Yeah.
No, absolutely. Very well said. So, Doctor, we had a couple of interactions earlier also. I
Yeah.
really want you to share your experience, which you have, implemented in your area of expertise and any of the localities or in India.
Yeah, I mean, see, I'm very passionate about raising the awareness because I believe, awareness is the prevention actually, especially in any cancer, especially in cervical cancer, because it is 100% preventable. So we have vaccines, we have screening tools at a different level, and then we have a treatment options also. So, but the problem is, even if we have all the options, wherever we are, there is particular community, mainly underprivileged. They are not aware about all these options that they're supposed to avail, and that is very close to their tertiary care hospitals actually. They're just maybe 5 7 kilometers, So what we did, we just started one, you can say, pilot study on, let's say, 100 samples, because WHO advocate a lot to do HPV DNA testing as a primary screening under at 70% screening bracket by high performance test. But the question is, how are we going to ensure that local community is going to avail that DNA testing, and then we can screen them, and if treatment is required, we can navigate those patients to the tertiary care hospitals, right? So we thought, why can't we some raise little bit of fund? Maybe if someone help us to support, we can scale up to maybe 10,000 in the initial phase, and so on actually. So what we thought, we are going to adopt a community forever, because different is goes out, different days come in, so some age group will be constant actually across the country, sorry, across the community actually. So we did pilot study. We sometimes it's very difficult to convince them because they thought ये तो गरीबों का तो है नहीं, अमीरों का ट्रीटमेंट है हम, if you even if you screen, nobody is going to afford the treatment part actually that is related to this particular cancer. That was their barrier actually in their mind. So we said, okay, we have those tertiary care hospitals. We are connected with those hospitals. We can you know take you to those hospitals if required, but don't worry, most of the time it's not required to go to that level actually. Let's see even if treatment is required or not. So we able to complete this educational part first at the different ASA workers or ANMs actually, and we adopted one small community in Gautam Budh Nagar. It's very close to Delhi NCR in Uttar
Amazing.
Pradesh. In Uttar Pradesh, and where our foundation is also in Noida. So Noida is under this Gautam Budh Nagar only. So we thought let's just start with this small community, and then we got a very good response. Good response in sense it was very difficult for us to educate the privileged one actually. And it's very easy to convince this community because they say, okay, you are god a figure like us, nobody visited us so far, nobody talk about this particular disease in our community, your team and your medical team, with the all staff with ASA workers, that is from their community only, so this is how we initiated this particular project at a community level. And uh, I'm sure we are going to scale up these same concepts across the country with the help of different stakeholders, different other not-for-profit foundations, and uh, anyone. I mean, anyone welcome to join hands with us at any level. We can, try to implement same strategy across the country if we get a support. Actually, this is what I wanted to tell you on this forum as well. Yeah.
Very well mentioned. And that's how we come to equity, access, and policy. So, as you mentioned, and I also, strongly believe that because the sciences already exist, no woman should die from preventive cancers. This death reflect gender inequity, poverty, geographical exclusion, and of course, policy inaction.
Yeah.
Now, when it comes to equity failure, the question goes to doctor, why is cervical cancer a health equity failure rather than a medical one?
Actually, if you look at the mission and vision statement of this Abir Bioservices Foundation also, where we have clearly pointed out 5A. I'm not going to talk about the A for one A that we already talked about, the awareness part that is complemented to all the 4A that I'm going to talk about. Like, let's say, uh, availability, affordability, acceptability, something like that. If even if technology is with you but it's not acceptable to you, for example, right? And reason may be anything. For example, I can see the major barriers, or you can say, the key equity health issue is access to the care. I mean, everything is there, but it is not accessible to the underprivileged one. What to do with that? Let's say we adopted the community, everything is there nearby within 10 kilometer of radius. They don't have to go too far, and but it is not accessible to, because they're not aware about it simply. So here, that is one failure actually, and other one is uh, in our community, it's because of deeply rooted socio-cultural or socio-economic factors sometimes, because poverty is something that is not in our control actually, right? And this anything, if you talk about the cancer, because of the low literacy, as we discussed earlier also, and weaker, you can say, or weak health systems disproportionately affect the outcomes actually, because even if everything is there but it's not proportionally distributed across the country, and this is one of the failure that we have seen. And another important part is because it's a sexually transmitted infection, we all know, right? So both the genders are responsible for this, and both the genders are need to aware actually. So if you talk about you can say gender based or racial or ethnic based also, there are a lot of different barriers are there where we are failing to equally distribute whatever tools and technology that we have so far in hand, but it is not accessible to everyone actually. And if you look at something that I wanted to bring you to your notice actually on through this forum, we have a vaccine, we all know, right? Since 2006, it's already approved by FDA. And then we have FDA approved vaccine with us. And recently we have indigenous vaccines also, from Serum Institute of India. That is, so even if we have a vaccine, but because of, you can say, it's not affordable to everyone. So it is not equally distributed wherever it is required, because vaccine is something that it can prevent not only cervical cancer but other sexually transmitted infection due to HPV, other cancers also, related to this particular disease, that can be prevented through vaccination. But here are some of the barriers that we need to discuss with the policymakers so that we can make it equitable and affordable also same time, so that everybody can avail, and we can have a national level policy for national immunization or national screening programs roll out very soon actually, so that we can save like preventable disease, or you can say preventable deaths, mainly from this particular infection, HPV infection, and this deadly disease actually, because this is 100% preventable. Again, I'm telling you so many times, because we have to keep in mind all the cancers are not something like death sentence. This particular cancer, we have n number of way to prevent it actually. So this is strongly I recommend to make it equitable everywhere, so that everybody can avail the services. Yeah.
Absolutely well said, Doctor. When it comes to the partnership, equity, funds, we all talk about it. But it's very important that how does the geographical areas has been considered. We might have seen many a time that maybe the metro cities might get the wide range or the wide variety of the acceptance, right? The accessibility is much more better. Even when it comes to the rural area, we may not know whether they will be having this proper opportunities or not, right? Even the policy inaction will definitely hamper the awareness programs or any kind of implementations which really adds value. Now, when it comes to the real impact which comes from a partnership, as you mentioned correctly, even with the national health system policies and the policymakers, they also talk about the woman health, reproductive health, and whatnot. However, the accountability does matters, metrics does matter. So, what makes a public and private partnership truly impactful as per your experience, and what is your journey so far? Insights, please. Thank you.
Uh, See, this is something that is impacting at a very large scale, and it's not like anybody can handle alone actually. So definitely we need a partnership, and we have seen actually, whether it's a medtech company, whether it's a government organization, whether it's a private organization, whether it's a non-government organization, even a small organization like us. We have non-government organizations like Gates Foundation and Welcome Trust from UK. They have created a great impact at a global level. So I also strongly believe in partnerships, and partnership can be between two individuals also. Let's see what we can do. At least we can save one life out of that partnership, that equally matters actually. So what I strongly believe is, don't talk about big jargons where public private partnerships are already there, like P3 policies. But even small acts, that what we are doing together, three partners come up with the concept, and we're trying to get out some information through this discussion, and we're going to raise awareness at our level. Maybe if we able to save single life from today's episode, I will be the happiest person on this world actually, on this earth actually. Why? Single life, each and every life is going to matter. Just imagine a woman that's recently diagnosed and she is going to deliver a child. What will be the future? So if we say, even if a single partnership can going to impact a single life, it's going to get a greater impact on the future of that newborn child also, because with the right intervention we can save the mother so that she can raise the child the way she want, and she can raise a healthy family as well. So this is something very important. We have to come out together and we have to work together, so that we can eliminate this particular cancer by 2030 up to some extent. But I can see Another 100 years is required if you go with the same pace, mainly in low and middle income countries where the strategies are there, but it is not implemented, not accelerated, not adopted. So this is partnership is one of the key aspect I can say is very much required. It is the need of the hour.
Amazing. It's a much more genuine answer, I must say. That yes, awareness plays a major role, and that's how we both are here. And I'm so grateful to Prem, my partner, Power of Knowing You forum. So, doctor, when you talk about the data, when you talk about even the research, have you ever come across with the identification of the cervical cancer or any particular, insight you want to throw when it comes to the, research on cervical vaccinations or the cervical cancer? Any insights on this?
Yeah, I mean, as rightly said, I'm very much open to the one domain that we have. If you look at the entire foundation, we have three key domains. The first domain is prevention and disease control, where we are talking about a lot of small things like healthy diet, exercise, and vaccines are available, then you have to go for the vaccination also. So screening, vaccination, some healthy diet, exercise, this is the first domain. So we are doing a lot of awareness related things. So because we have to get informed first, then we can take an informed decision. The second domain is that we are here today for the public engagement activity. So we have done a lot of activities so far, like different workshops, conference, CME, invited guest lectures, and trust me, I'm not alone in that journey actually. Now we are growing like anything day by day actually, and we all are together in this public engagement activity, and this is one of the activity that we are doing today also. The last one that relate to your question is that health education and research, the last domain that we have, and this is well structured, well defined. So we have done a small a study that we supported through our foundation actually. Let's say we are investing a lot in training the future resource manpower so that they can lead by example. How? We completed one dissertation in 2020 from the MD background, and we trained how to screen all STI panels, including HPV also. It was a small thesis, submitted, awarded, and she chose as a career actually. That was the impact of the research that we have seen in our like last 5 years actually. And then at the same time, we are trying to train the masters from the science background as well. So one is from the medical background, one is from the basic research background. Why? Because they need to work together for the benefit of patient actually. So we are promoting lot of small you can say research based upon our own capacity, the funding that we have, limited funding you can say, and most of the time it is well supported by institute. Okay, just consider this part from your foundation part, rest of the thing we can taken care by our own department as well. That is a very good support for us. Let's say one study require 5 lakhs of fund to complete that dissertation actually on a molecular level actually, right? So we are contributing some to the some extent. Rest is supported by the host institute, and we have signed a lot of MOUs, and MOUs will be in the different stakes to promote the research. One is the health technology partner, the private limited I'm talking about. And the other partner is educational institutions, central university, government and private, and medical college as well. And some of the independent labs, those who are having this technology, or those are private limited companies, those having this technology to, screen at a very effective way without compromising sensitivity and accuracy. Though we are promoting those services actually through a foundation also wherever it is required. So we are very much into first part is health education, and then second part is research to complement that, and we try to strengthen the capacity building across the country. And I'm very happy to uh, close couple of projects actually in recent past decades actually, through foundation as well.
Okay, great, great. I believe the research is something is very important, and one of the strong quote: "If you cannot measure it, you cannot find it." Right. So that's how the research plays a major role. So we talk about a lot of medtech digitalizations. We speak about the equity. even we are discussing about the policies makers, etc. But when it comes to HPV vaccination, which has to be promoted early for sexual behavior, evidence clearly shows it does not. It is cancer prevention vaccine, and delaying due to misinformation cost, which is lives, right? So one misconception about HPV vaccination policymakers should understand.
I think there's already a lot of debates on this part. Initially we have very false evidence actually that was proved later, because कई बार लोग सोचते थे ना वैक्सीनेशन से डेथ हो गया. So that was a major barrier in the initial stage around when initially vaccine was launched actually. Maybe that was because of any snake bites in local community, but I mean particular individual was vaccinated that time. At the same time, that risk was there because of her profession actually. So that was the major barrier initially, but it was ruled out. It is nothing to do with the side effects of the vaccine. This is something else, and it was published in national newspaper as well. So that was the one thing that policymaker was now relief. Okay, that part we have covered, because a lot of vaccination part stopped during that time because of this myth that जैसे कहते हैं ना कि झूठ एकदम तेजी से फैल जाता है, सच तो वहीं बैठा रह जाता है, मतलब.
True.
So that was the issue initially, but at the same time, what we are facing right now is during this time, during our era actually, uh, एक जैसे होता है ना कि वैक्सीन हमने दे दिया, गार्जियन के दिमाग में ये कि हमने वी आर गिविंग द लाइसेंस एक्चुअली टू हैव मल्टीपल सेक्सुअल पार्टनर्स, और यू कैन से promiscuity, so this is one of the myth, because this vaccine is nothing to do with the license or something, give you confidence that okay you can have the multiple sexual partners actually. But it's equally important to educate them how important to prevent with lot of HPV related infections. Like there are 6 common cancers actually related to both the genders. Like oropharyngeal is coming up in a big way. Now people are aware about it. Oral cancer, oropharyngeal cancer, or anal cancer, penile cancer. This is all related to male actually. And if you talk about the female, again anal is common, oral is common, and cervical cancer is something that is strongly correlated with HPV infection. So what I'm trying to say is, nowadays, because of lot of WHO initiatives, because they have taken a lot of initiative to how to get informed, how to get information that is floated across the country, across the globe, in a structured way, in a very well systematic way, so that everybody will aware about, not only policymakers, not only healthcare providers, we as an individual actually, those who are the beneficiary, and they can get the information, right information, and not the myths, about just the facts actually, so that it is easy to execute or implement the strategy or the guideline that we have so far. So this is what I wanted to tell you, 2 3 things that was just pop up in my mind actually. I was not expecting this question, so I thought let me add to this actually. Thank you so much.
Yeah,
Yeah.
absolutely, absolutely. You mentioned making cervical cancer screening a routine, integrated primary healthcare services linked to digitally diagnostics and the treatment, especially for women over 30. Now, do you believe one system level change that could reduce death by 2030? What is your take on this?
So simply, I mean, something I wanted to add, and I'm very clear on this thought process actually. There are 3 things actually. One is research, that we already discussed the importance of research, we all know. And the second one is the policy makers. And the third one is the implementation. So if we have a research, now we have a policy. Guess what if it is not implemented? So based upon the research, based upon the data across the globe, WHO come up with a strategy to eliminate the cancer, let's say by 2030. And we as a scientist witness to the country, to name few, like Australia or some other countries. They started early, you can say 2010 or 2011. Now they're close to elimination, right? So it's very important to implement this the strategy, even if it exists actually, it's well framed actually. So I can see there is a lot of gap even if we have a policy, even if we have a strategy to eliminate this cancer, it is not implemented so far across the country, mainly in low and middle income countries.
Yeah, very well mentioned. That definitely it is going to be the work. It is going to be, the collaborative approach, where the partner like us, we coming together, sharing the insights, supporting to the people, supporting to the team, which can really add value. So when you talk about the elimination, uh, elimination means what? The no woman dies because she was invisible to the health system. I don't want any woman to die, especially with the cervical cancer. So, what does elimination truly mean beyond statistics?
It's well framed question, you can say, but truly means what does it mean is say, just elimination is not just achieving the goal by 2030. Even if we achieve before that, we must say we are very proud to do that. Why? Because according to me, this is a major public health concern actually, and with immediate, you can say, action or implementation, we can come up with lot of suffering and agony related to this particular disease. So elimination is something not just a catchy word as per WHO guidelines. It is something to related to some, something associated with some suffering and deaths, that is already we are aiming for non-existent at all. Because in future, for let's say for the sake of our children, in the near future, we don't want this disease to exist at all actually. Why? Because we have all tools that is required to manage this particular disease. We just need to get aware about it and take the services that is available with us. We just have to ask for it or strive for it. We have to aim for it so that we can live free from this particular threat actually that is there in my mind. Okay, cancer is something, the death sentence. So if we can able to eliminate this particular cancer within our own you can say lifespan, we will be the luckiest person over there actually, so that we can save some life or life threatening disease like this in near future also.
I completely echo your statement because cervical cancer is preventable. Early,
Yeah.
early, and I must say that every death represent a failure. We already know how to fix it. Okay.
Yeah.
With this, I would like to, add an important comments here. Cervical cancer elimination is not a future goal. It is a current responsibility. We must move from commitment to execution, from pilots to policy, and from innovation
Yeah.
to equitable access. So every delay is a life
Yes.
lost, and we don't want that, isn't it? So thank you so much,
Definitely.
Dr. Niaz. It's been really pleasure and amazing. I must say we had opportunity to discuss important topics when it comes to statistics, which represent the systemic silence, not delayed care. We spoke about from numbers to system. Why do system fail most before the screening, during diagnosis, and detection? After detection, we
Yeah.
spoke about the technology, knowledge, diagnostic, medtech, and continuation of care, even the policy reference, even the point of contact care when we have equity, access, and importantly, the gender inequality and the poverty and geographical exclusion. These are the area still need to be considered and learned more. We also had important discussions on what makes public and private partnership truly impactful, what we did today on the awareness campaign.
Yeah.
We spoke about the vaccinations, we spoke about the, what is WHO important goal. With this, I must, congratulate and thank you so much for this amazing session. Now, let us take a couple of questions from the chats. Thank you so much, Dr. Niaz.
Thank you. Thank you.
Yes. So I must read here. We had an amazing comment from Indian Academy of an Entrepreneur who says, Honorable Dr. Jyoti and Dr. Kausar. We had amazing sessions, and on behalf of IAEG Global Worldwide Family for such a lovely initiatives. And thank you so much. We also wish you all the best. It's an amazing. Thank you so much. Miss Khushbu Gupta, she says, a much needed discussion on cervical cancer. The key message around prevention and early interventions were clearly communicated. Thank you so much, Khushbu, for attending the session with us. Another LinkedIn user who says, in India, cervical cancer cases rising steadily, yet the availability of the effective drugs is limited. Low domestic production and access gaps continue to hinder timely and affordable treatment for a patient, and a mass screening is needed. Doctor, I would like you to add a couple of your thought process because you've been working since a decade now. Please.
Can you read the question one more time?
Yes,
It's
he's
in
saying,
front of my screen.
yeah, it is in front of your screen. It says
Yeah.
that the
Hmm.
cervical cancer cases are rising, but we have
Hmm.
a issue with the availability of the drugs because it's a limited, and there are major issues. So, is there any insight from your expertise we can think through innovatively? Yeah.
See, there are two things because I'm a little confused with the question that is displayed on the screen. One, at the end, they are talking about affordable mass screening, and in the first question, they are talking about the drugs or the treatment part that we are talking about. So let me make you very clear, insight on this. We have a treatment option that is for sure. Like in terms of drugs, you can say we have a very well established therapy or immunotherapy or a lot of advancement is going on. Like CAR T cell therapy is still on the way. It has to go little different phase actually to bring into the public domain and make it affordable actually, because CAR T still is not affordable. So government of India is also working on it, and a lot of different are investing heavily on this across the globe, in India as well. And we are looking forward to have more effective, customized, as well as the dose dependent immunotherapy and chemotherapy in near future, so that we can reduce the side effect. We all know the effect of chemo, those on the treatment. So I also personally have a couple of friends who started the company 5 6 years back. They are in the Pune best actually, and they gone through some of the personal, you can say, the treatment that going on her own father actually. And then she started how to optimize the dose even if drugs are available. And if dose is not optimized, that is as per need of the patient, personalized dose I'm talking about, it's going to create more side effects rather than effects on her body actually. That what we have seen so far. So that is one thing. And as far as affordable mass screening is concerned, we have all the options with us. And as a scientist, I also contributed in this particular area, so to develop first indigenous real-time PCR HPV detection kit for early, cost-effective screening actually, that can be rolled out in mass screening when government of India is going to adopt, national screening program under that umbrella, where WHO advocate 70% population must be screened by age 35 and age 45 at least twice in their lifetime by high performance test. Under bracket they have clearly mentioned HPV DNA testing rather than cytology testing or visual inspection by acetic acid that is there in the program. So this is well taken question actually, and I wanted to clear your both the aspects in the same question actually. Thank you so much. Yeah.
Amazing. Doctor, there is one more back-end question which I've received. Like when it comes to the school level awareness campaign, and you see in India, the urban population is still aware about it. But as you mentioned earlier, being educated and being aware, these are two different things, right?
Yeah.
So, how do you redefine the concepts at the rural area when it comes to the school levels awareness campaign?
See, Jyoti, I think I need your help in this area, to be honest.
Hmm.
I'm not shy about to discuss on this forum as well, because
Hmm.
this is what this forum is meant for. As far as this education, I'm talking about health education.
Mhm.
Trust me, this is nothing to do with the school that is there, let's say DPS group, for
Mhm.
example, or
Mhm.
any other uh, well infrastructured schools. They are not aware about that the vaccine exists against HPV and it is STI. It is sexually transmitted infection. I'm talking about so-called Cambridge or any convent school actually, because I have frequent interaction during my son's admission actually last year to different schools. Actually, I'm talking to the principal. I'm talking to the teachers. Actually, they are not aware about it. So one thing is very clear: we need to walk across the length, breadth of the country, irrespective of where that school is, what the background of the school is, what is the infrastructure, what is the you can say educational qualification of the entire team, the teaching team that is there. Teachers are there actually. So trust me, again, I'm telling you based upon my personal experience, because I visited a lot of government co-ed school in Delhi NCR, and they are very very receptive to what we are trying to tell them actually, related to this vaccination drive, because they know that it is not affordable for us, but yes, they are very very much willing to adopt it even if we provide them a chance. So our foundation also working towards this, how to make this vaccine accessible to them, by like collaborating again with the partners at a global level, so that we can receive a vaccine at a very affordable rate, and then we can pass on to all the beneficiary. Once we educate them, we have to serve them also. We cannot say, okay, you are now educated, just our job is done, right? So this is what we are thinking. So we have to work in all the schools across all the states, across all the country, land, breadth, and this is how technology is going to play
Yes.
important role. Through technology, we can reach each and every corner today's digitally at
Yes.
least. So this is what I wanted to tell you,
Yes,
very
yes,
very
absolutely,
straightforward actually. Yeah.
absolutely. I must say, Dr. Niaz, it's a really indeed pleasure to have you with us. This amazing forum with the JVA Tech and the Power of Knowing Forum in collaboration with the MedTech Insight First podcast. And I'm sure that in India we look forward for having the more awareness programs which can really help us. And as we said that yes, every 2 minutes we have to act because any delay is not good, but awareness is always we can create, and we can have the leveraging this opportunity to work with our country, and as a Indian how we can support in healthcare domain too. Once again, congratulations and thank you so much, everyone, for being a part of this wonderful podcast. And stay tuned for such a great sessions upcoming. We'll keep you posted. Thank you once again, Dr. Niaz. Thank you, Prem, for being a wonderful partner through Power of Knowing Your Forum. Thank you so much.
So Jyoti, if we have 1 minute
Yes,
time, if you
I
allow
will.
me, I wanted to conclude this session actually from
Yes,
my perspective as
yes.
well, if you allow me. See, to eliminate this particular cervical cancer as a public health problem, uh, one thing is very important. We have to immediately, or you can say immediate or collective action, from the government or medtech innovators as well as healthcare leaders. They have to come together, and let's see how we're going to implement or execute, at least at our own community level, immediately, without any further delay. And I wanted to quote one very very strong statement that was quoted by Director General WHO, Dr. Tedros, in 2019. We have a vaccine, we have a treatments, and we to detect the disease at a very early stage. So he said, it's there on his entire social media platform on Twitter and everywhere, on WHO website, YouTube as well. If we have all the weapons in hand, then failure should not be the option.
True.
So with that message, what we wanted to we try to say is get informed, get screened, get vaccinated. If required, go for the treatment at a very early stage so that we can eliminate this particular cancer as a major public health problem. Thank you so much. Thank you so much for giving me this space to come, share this quote from the WHO Director General, Dr. Tedros as well. Thank you.
Amazing. Thank you so much and have a great evening.